Hi, I am Dr. Samir bin Osman, and in this video we're going to talk about the principles of psychology and psychiatry. So these study basically how the mind thinks and how it behaves, and then the disorders that can affect its behavior and the way they're treated. The brain learns about the environment and other people using cognitive processes, which impact their personality and behavior. And any imbalance of this integrated system can lead to what we call mental disorders. So let's talk about cognition and how the brain learns. So the brain has specialized networks of nervous cells called neuronal networks that process either internal stimuli like cold, hunger, satisfaction, etc., or external stimuli like objects or people, events, to form an idea about what things are. What a square is, what a circle is, who are people, what are the tastes, etc. So they learn basically about the world. That's how they construct neural networks that learn about the world. And they then learn how these things behave and how they impact the individual. And so, for example, they cause satisfaction or repulsion from certain activities or experiences, or they could good memories or bad memories, that sort of thing. So this enables the brain to form what we call a model of the world, i.e. a vision of the world. That starts with vision, hearing, and all the senses that it has to form the model of the world. And then it's going to reward activities or experiences that the brain deems beneficial. So by secreting molecules that release pleasure or fulfillment, etc. And by quote-unquote punishing other experiences that are deemed bad by releasing molecules in the brain that's going to make the person feel pain or remorse, etc. And so in the pursuit of efficiency, these networks learn and create shortcuts, basically. So it's like highways of neurons. We're creating more connections between neurons in what we call synapses, as you can see here. And so the more shortcuts it creates, the more it enables quick and easy identification of the new stimuli similar to the one learned before. So it doesn't have to think to know that this is a man and this is a woman and this is a child and this is good and good for me and this is harmful and this hurts and this doesn't hurt, etc. So the more the neuronal network gets used, the more interconnected it gets, reinforcing the learning that it acquired and creating what we call habits. So you don't have to think about those anymore. So the same way goes for memory networks, by the way, that store past events in those networks, and then they recreate them every time you need to recall those memories. Now, this efficiency, however, renders those pathways vulnerable to errors and being able kind of to be tricked by things that don't occur all the time and can basically induce the system into error. And they're called biases. And so there are many examples of biases, some of which are kind of benign and others less benign. So some of the benign examples include optical illusions, and everyone is familiar with those. You can see, for example, on the right-hand side, those arrows seem to be of not the same length, but when you put them in red, you can see that the straight lines are exactly the same. It's just that the way they're organized makes the brain pathways, the neuronal pathways in our brain, think that one is longer than the other because it's used to shapes that are longer or shorter that look like these. And then we have less benign effects, and we're going to give a number of those. We're not going to give all of them, but these are the ones that influence how the brain can be tricked, basically. So first is the memory biases, which is that the memory can be altered by events that happened after the event that we want to recall. And so when we recall it, we may recall it differently. Also, we have, this is called the misinformation effect, by the way. So also we have the confirmation bias, which is basically selectively favoring facts that support our claim and selectively deprioritizing facts that do not support our claim. We have also the optimism bias, which is estimating better outcomes for oneself than for the general population, i.e. like bad things only happen to other people type of thing. We have also the anchoring bias, which is basically the fact that we're overly influenced by the first piece of information, even if it's false, even if it's later on proven to be false, we anchor to that first information. So that's a bias. It's an anchoring bias. We also have what we call the availability heuristic, which is the bias of overestimating the frequency of an event based upon how many recent examples recently come to mind. So someone can tell you, well, car accidents increased a lot recently, and it's a catastrophe. And you say, why? And was like, well, I witnessed a car accident last week, and then I witnessed another one like 2 months ago, definitely going up. But then if you look at the statistics, it may not be true. It's just that the fact that the person has seen recent examples, we will tend to overestimate the frequency of an event occurring. Loss aversion is another bias, which is preferring to avoid loss rather than trying to get benefit. And in many cases, actually, this is protective, but it can be also a bias. And then we have group biases that can be less benign, probably more destructive, which is acting along with the group and doing what the group does, and not being inclined to go outside of what the group does, just kind of conforming to the group. And also the other bias that comes from that, which is kind of favoring the groups that are within the member to the groups that are outside the member, be it in jobs or in political work, or like whoever we consider as outsider, we're gonna disfavor them, and many more biases. So all of these cognitive networks and cognitive biases and the events will make different personality types. So let's talk about those. So people have different personalities, which are mostly due to their genetic makeup, as well as the cognitive learnings and biases that were shaped by their parents, environmental events, and society, and reaction to behavior, etc. So these personalities will significantly vary, but tend to follow a broad personality scale. It's called OCEAN, which is openness, consciousness, extroversion, agreeableness, and neuroticism. So openness it has a range, and every one of those will have a range. So every person will have a score on one of these scales, and the sum of these scores will define their personality. And so, for example, openness can range from being curious and innovative and sometimes reckless to, on the other side, being like more prudent and more withdrawn, calculating. And consciousness can range from being overly orderly and planning to the other side being like more spontaneous, like wing it as we go. Extroversion can range from being sociable but also like emotional and impulsive to, on the other side, being kind of more reserved and more calm. Agreeableness is the ability to put others' needs before their own, and it can range from being altruistic, friendly, and trying to please the others, to, on the other side, being less influenced by what people think, but also like less in tune to what people to people's emotion. And then neuroticism is the ability to control, to be affected by events, let's call it that way. So it can be being anxious and irritable on one end, and also like more self-conscious and confident on the other end. And so all of these personality traits, also these scales, they will define personality traits. And so as such, they are important to be known by each individual, that's first. But also when we put individuals in workforce, it's important to know what personality type they're in. And so what type of work will correspond best to their personality type, and put them in a position of success rather than put them in a position of stress. And also, for example, it's important to do those personality tests, especially when we put people in confined zones. For example, when we put astronauts in a space station that's kind of a very small space for a long time, if they're not incompatible personality types, there can be like clashes and all sorts of problems. So it's important to know the personality types and put them where they belong best. So how do these personality types affect the beliefs and the behaviors? So we have basically inputs, which are ideas that are taught either by the family or authority figures or institutions, be it social institutions or like governments or whatever kind of puts input into the minds of people that are combined with events, such as what happened to the individual. All of these inputs are interpreted by the people according to their personality type and genetics, etc. And so they will adopt beliefs. And those beliefs can be either empowering beliefs about themselves, i.e., I can, I am capable, etc., or limiting beliefs such as I can't, I'm not capable, etc. And this will shape their self-image. But they can also adopt beliefs about other people or groups of people. So you can say, men are etc., doctors are XYZ, Africans are blah blah blah, whatever. So these kind of beliefs tend to get generalized, as well as beliefs about life itself. So because people are like this, well, life must be a test, or life must be a lottery, or life must be just about money, etc. These will shape the values over time that one will adopt, i.e., I must be honest, or I must be cunning, or I must get power, or I must get fit, or whatever. And these combined with more events can shape more and more of the habits. It's important to note that the same events can have opposite interpretations and make people have opposite values depending on their personalities and their upbringing, etc. So these values will dictate their behavior and how they interpret the people's reaction to those behavior, further either reinforcing their beliefs or not, but mostly reinforcing their beliefs. And then repeated behavior becomes part of the identity of people. And people will not verbalize this and say, well, this is my identity to help people or to steal from people or whatever, but they will rationalize their actions by giving justifications. And those justifications can be either objective or subjective or completely unfounded, depending on their acquired beliefs and their personality. So society is gonna reinforce group beliefs, which are easier to conform to because everyone is doing them, and they will require little justification beyond repeating what the group says. And so, however, major events such as death of a relative or an important fact that the person didn't know before, or the event of dictatorships or wars or natural disasters. So such major effects can cause individuals to change their beliefs. They can even cause societies to change their beliefs and values and behavior. Behavior change can also be conscious by deciding to create new habits. If we want to stop smoking or start working out or like having a healthier diet, etc. And the process of creating new habits is by starting with small steps and repeating them on a regular interval and rewarding them so that we teach the brain that this is a good thing to become, to make a habit out of. And so we make a routine to create good habits and replace bad ones. So what happens when these processes don't work well and create mental disorders? So first of all, what's the prevalence, i.e. how many people have mental disorders in the world? Well, studies estimate that about 1 person in 3 has a mental disorder. And it looks like this number is extremely high. However, I need to put a little bit of salt into this. So there is kind of a bias in psychology and psychiatric studies. For example, 91% of psychological studies have confirmed the effect that they were looking for. And one would wonder why most of them confirm the effect that they were looking for. One would expect that, about maybe half of them would confirm, half of them would say, no, it wasn't the case. But no, most of them confirm what they had in mind. And what's worse is that, about 60% of those studies are not even reproducible, i.e. other researchers cannot reproduce the same results. And then we have the problem that most are done on volunteers, that what they call the weird population. WEIRD is an acronym for Western, Educated, Industrialized, Rich, and Democratic, WEIRD, WEIRD, which actually constitutes only 12% of the world's population. So we're extrapolating to the rest of the world based on a small sample that's not even representative of the world. So that's why we need to put a little bit of salt into these numbers. So what's the cause and manifestations of these diseases? So, the specific causes of mental disorders are not always well understood, but generally would involve a combination of genetic predispositions, such as certain personality types with high neuroticism or emotional instability. They're combined with ideas and events that occur during the childhood or early adulthood of that person, such as family dysfunctions, like abuse or neglect or rejection, or on the other hand, excessive spoiling. Excessive spoiling, by the way, can cause narcissism. Or social stress, such as bullying at school or discrimination at school or at work, or stresses at work, etc. And traumatic or overwhelming events that can occur in the person's life. In addition, there is a medical component to this, which is caused by some chronic diseases, such as heart disease and certain cancers and certain diabetes, which can cause depression, by the way. And also, bad nutrition has been shown in some instances to increase the risk of mental disorders. These there are also neurodevelopmental, what we call divergences, that are not classified as mental illnesses, and they include, for example, Asperger's syndrome and autism, which are basically different configurations of the brain that makes them challenged with social skills and causes repetitive behaviors, etc. So how do these manifest? So they manifest usually around puberty, and they will manifest in two major ways. Either, depending on the personality and genetics, etc., the person will be internalizing this mental disorder towards themselves by having anxiety or depression, or going into irrational fears, delusions, or even substance abuse, or at the opposite, externalizing those disorders towards others, such as exhibiting traits of manipulation, narcissism, aggression, delinquency, etc. So the most common disorders in the world, mental disorders, include depression, which is generally defined as the loss of interest in daily life, followed by bipolar disorders, which are alternating episodes of depression, and then manic phases, where people get kind of overly maniac about things, and then followed by schizophrenia and other psychosis, which are defined as episodes of delusions and disorganized thoughts, and then demotivation, etc. So how do professionals diagnose these mental disorders and divergences? So diagnosis is done first during the mental exam, which is basically based on the appearance of the patient, their behavior, as well as their self-reported symptoms and mental health history. So basically what they tell us about themselves and what other doctors have noticed about them. Sometimes combined with psychological testing, which is basically done through questionnaires. Mental health diagnosis, as you can see, still relies on subjective judgment by the professional and limited evidence-based methods. And oftentimes it causes overdiagnosis and misdiagnosis. It is also of note that psychiatrists also do a clinical exam to see if there are any chronic or underlying medical diseases that are causing or exacerbating this mental disorder. And so going back to the subjectivity in the diagnosis, this subjectivity has prompted efforts to explore the use of neuroimaging to establish a more objective diagnostic method and diagnosis criteria for mental diseases. However, this is currently still confined to research settings in specific disease conditions, and it's far from being ready for clinical use. So now that diagnosis has been established, what are the principles of treatment in psychology and psychiatry? Well, like we said in medicine, the best treatment is prevention. And so prevention of individuals who are high risk would yield the best results through promoting healthy family dynamics, through preventing social stresses at school or at work, and promoting a healthy lifestyle, etc. And then treatments will fall into two main categories, psychotherapy as well as medication. And medication is reserved for psychiatrists. And it seems that psychiatrists are increasingly focusing on using medications and referring patients to psychologists for psychotherapy. So let's talk a little bit about psychotherapy. So there are a number of approaches to psychotherapy. The first of which is cognitive behavioral therapy, or CBT, which is the principle of which is modifying the patterns of thought and behavior that underlie the disorder and try to change them. And then we have another approach which is called psychoanalysis, which is addressing the conscious as well as the subconscious underlying psychic conflicts and defenses and trying to fix them. Then we have also family therapy for disorders where like there's a family component, and so that's based on addressing the patient with their surrounding family members and working with them. And then we have also another approach which is called a humanistic approach, and that's basically prompting the patients themselves to kind of positively use their own personal instincts to find healing and also like fulfillment beyond healing. And these approaches are a little bit schools of thought. So many people will belong to one school of thought to the other. And then certain people are saying, well, let's integrate all of those into what we call integrative psychotherapy, which is a more comprehensive approach that takes from each of those approaches. However, the integration is not yet, let's say, standardized or well established, and maybe it may be the future of psychology in the treatment. Now, in addition to that, we have what we call medication. So mental disorders can be treated with medication, which acts on specific protein receptors in the neurons that are in the brain regions that are responsible for, let's say, mood or emotions, etc. And we target them with drugs that go to these specific proteins and block their function and kind of calm down the networks that are over-exacerbated. And so the problem with the medication in the brain is that there is a lot of similarity of the neuronal pathways. And so these drugs, they will go act on the neuronal pathway that may be over-exacerbated, but they will also go act on neuronal pathways that have nothing to do with it, because the protein happens to be here and happens to be there. And so that leads to many side effects that can also affect the life of the patient. So they need to be used with extreme care. Also, I just want to point out that the mind and the brain often perceives the pill as effective even if it doesn't have an active drug. And that's called the placebo effect. And actually, it's sometimes used in psychiatry to successfully treat patients with placebo, so like no side effects, basically. Due to the tendency of overdiagnosis and misdiagnosis, as we spoke before, there is, however, a subsequently high tendency of drug overprescription. So one needs to pay attention to carefully using medications to treat mental disorders. And with that, we came to the conclusion of the principles of psychiatry and psychology. Thank you for your attention. I appreciate your feedback, and I'll see you in the next video.